Hi, it's Sator from Hierarchy Acupuncture and Herbs. In this video, I'll be explaining how you can use acupressure points to treat wrist pain caused by the Quervain Tenosynovitis. Quervain Tenosynovitis affects the tendons on the thumb side of your wrist and can cause pain, swelling, and tenderness at the base of your thumb and wrist. Our modern lifestyle, which involves using your thumb like typing, texting, and playing musical instruments, can contribute to this disorder. Utilizing the ancient wisdom of the traditional oriental medicine, I have developed 6-step acupressure massage techniques that you can easily perform at home to reduce pain and swelling in your wrist and thumb. Acupressure is a technique used by acupuncturists to apply the pressure to a specific point on your body. By using your fingers to pressure these points, you can achieve the similar effect and find a relief from discomfort. Hopefully, these techniques will help alleviate your wrist pain and prevent the need for injections or even surgery in the future. And first, I want you to check if you have a Quervain Tenosynovitis or not by using a simple stress test. It is called the Finkelstein test. To do this test, simply grip your thumb with your fingers and then bend your wrist towards your little finger. If you feel the pain on the side of your wrist, you may have a Quervain Tenosynovitis, which is the inflammation of the tendon sheath in your wrist. And what is tenosynovitis? If you are confused about the difference between tenosynovitis and tendinitis, let me explain. Tendinitis is a solo inflammation of the tendon, but tenosynovitis is the inflammation of the tissue surrounding the tendon, known as the tendon sheath. Two muscles tendons are involved in this tenosynovitis, the abductor pollicis longus and extensor pollicis brevis. When you extend your thumb outward, these thumb muscles contract. So as we talked about before, we've got some tips that might help you feeling better. One thing you could try is acupressure treatment, which can help to release the tendon and improve the blood flow and promote healing. Step 1. Lung 7. The first acupressure point is located between two muscles called abductor pollicis longus and extensor pollicis brevis. This point is known as lung 7 or rekketsu in Japanese. The lung meridian pathway, which starts from the internal organs include the lung, ends at the nail bed of the thumb. This point is usually used for the lung disorders, but it is also helpful for the wrist and thumb pain such as Quervain Tenosynovitis due to its pathway and anatomy. But this point may be sensitive for people with a swollen wrist, so it can be skipped. To locate the lung 7 acupressure point, start by putting your hand with the thumb up. Look for the depression at the base of your thumb. Place your other thumb in the depression and slide gently until you find a small depression about 1.5 inches away from the wrist crease. This is the lung 7 point. To apply pressure, use your thumb to rub in a circular motion for 10 seconds. Step 2. Triple 1 or 5. The second acupressure point is known as Sanjiao or triple 1 or 5. It is located on the back of your wrist, 2 inches away from the wrist crease. This point is actually the pathway of the extensor pollicis brevis muscle, which originated from the back of your forearm, loops around the wrist, and ends at the base of your thumb. To locate the Sanjiao 5 acupressure point, place your thumb or finger on the top of your wrist crease and slide down about 2 inches. When you press down, you may feel some soreness or tenderness, indicating that you have found right spot. To release the muscle tension in this area, massage the point in circular motion for 10 seconds. Step 3. Large intestine 10. The third point is known as the large intestine 10, and it can be found at your elbow. It is because the muscle at the elbow is connected to most of your extensor muscle of your wrist and the fingers. If these muscles are tight or overworked, you may experience the tension in your wrist. Large intestine 10 is an effective acupressure point for the easing pain along the large intestine meridian. To locate the large intestine 10, Start by bending your elbow and then find at the end of the elbow crease. Then slide your finger down about 2 inches until you feel the depression at the edge of the forearm bone. Using your thumb, rubbing it a circular motion for about 10 seconds. And step 4, Lu10 and large intestine 4. The step 4 of the treatment of the wrist pain involving using a Lu10 and large intestine 4 acupressure point together. These points are located near the attachment of the extensor pollicis brevis and abductor pollicis longus and are highly effective in treating wrist pain. To apply pressure, grip your thumb bone and move your fingers up and down along the edge of your bone for 10 seconds. Step 5. Cervical 6. The next acupressure point is located at the base of your neck at the same level as the cervical 6. To find the spot, first, flex your neck and locate the most prominent bone, which is the cervical 7. The spot you are looking for is one above that, which is C6. The reason for the massaging this spot is based on the dermatome theory. According to this theory, each nerve controls the certain area of the body. For C6, it is responsible for the thumb side of the arm that comes from the wrist. The dermatome is the nerve innervates to the skin and it detects pain, tingling, and the weakness. Acupuncturists often use this chart to stimulate the points, which is very effective. Once you find the spot, rub the area for 10 seconds. Step 6. Scalenes. The last acupressure point that can help with relieving muscle impingement and the pain is called ST11 or scalenes. The key to effectively treating this issue is to focus on the nerve innervation. The brachial plexus, which is the bundle of nerves that run through the neck, branching out to the arm and hand, play a vital role in this process. People who spend a lot of time sitting at the desk, typing or texting, often have a poor neck posture leading to the tightness of your neck and the compressing of the nerves. This compression can also affect the radial nerve, which controls the thumb. Releasing the scalene muscle can help to alleviate the neck tension and wrist pain. Rubbing the area in the circular motion for 10 seconds can be effective. Doing this acupressure exercise on a regular basis can help speed up your healing process and avoid the need for steroid or surgery. If you're still having a trouble with your thumb and wrist, you might want to consider alternative treatments like acupuncture before deciding on surgery to cut your wrist. I hope you or someone you know can recover from Quervain Tenosynovitis sooner. Thank you for watching and see you in my next video. Take care. Bye.